to our Zoom meeting. Today we're going to talk about different topics. So welcome, and let me just make sure the recording is okay. Okay, welcome everyone. Today we're going to talk about stroke, and Dr. Nasila will start. And when you're ready, please go ahead, Dr. Nasila. Thank you.
Hello, can everyone hear me?
Yes.
Thank you. Okay, Bismillah. So today we're going to talk about strokes and cerebrovascular disease. I'm going to do a short presentation on the subject. First of all, I'm going to give you a quick overview. So we're going to go through the definition, the epidemiology, and statistical analysis of strokes, their classifications, the pathophysiology behind them, their risk factors, clinical presentation, diagnostic measures, as well as the acute management of a stroke, the secondary preventions, and finally, the complications and prognosis of strokes. So first of all, what is a stroke? A stroke is a sudden onset of focal or global neurological dysfunction. Usually it's caused by a disturbance, my apologies, 1 second, by a disturbance in blood supply to the brain, in cerebral blood supply, resulting in brain tissue injury. It is caused either by ischemia, which is a reduction or hypoperfusion of blood supply, or a hemorrhage, which is a vascular rupture inside the brain, of course. When it comes to the epidemiology of strokes, well, we have to know that they are extremely common and they have a high occurrence worldwide. For instance, the incidence of strokes are nearly 12 million new strokes occurring each year globally. In terms of deaths, there is nearly 7.25 million death by strokes, making it the second leading cause of death globally, right after cardiovascular events. And last, well, there is nearly 100 million people who survive the stroke and are living with the after effects or the complications of a stroke worldwide. So it's something that we see very often in hospitals. Now we're going to speak about the types of strokes. We have most commonly ischemic strokes, which represent over 60% of all cases. They can either be thrombotic, caused by thrombus, which is a formation in situ of a thrombus within a cerebral artery, or they can be embolic, which is usually a thrombus that is formed elsewhere and then migrates to occlude the cerebral artery. And the second type of strokes is a hemorrhagic stroke, which are less common than ischemic, but still they are very present. They can be classified as either intracerebral hemorrhages, usually due to chronic hypertension, which weakens the blood vessels and tend to rupture. Or they can be subarachnoid hemorrhages, which are often caused by ruptured aneurysms or arteriovenous malformations or trauma. There's also a less common but still existent type, which is called a transient ischemic attack, which is a stroke that is of course due to cerebral ischemia, but that resolves usually within 24 hours, and there is often no evidence of it in imaging exams, but the patients come to us and they describe to us a typical clinical stroke. Now we're going to see the pathophysiology behind the stroke. There is different pathophysiologies for the ischemic versus the hemorrhagic one. So for the ischemic stroke, usually there's a blood vessel that is occluded, again by a thrombus or emboli, which causes a reduction in cerebral blood perfusion and results in what's called a core infarct. So the area that is now less perfused is going to go through necrosis. And surrounding that necrosed area, there will be something called an ischemic penumbra, which is a tissue that is hypoperfused because of the stroke, however, is still viable. It's still salvageable if we intervene in time. And at the cellular level, there is an efflux of glutamate and an influx of calcium inside the cells, which cause a release of free radicals and therefore the formation of apoptosis and inflammation and pretty much the death of the cell. When it comes to hemorrhagic stroke, there is a rupture of a vascular structure inside the brain, which causes blood to come outside of the blood vessels, of course, which in turn results in a mass effect and edema that is going to push the cerebral or brain structures and cause hypertension, like intracerebral hypertension. So there is right after that an ischemia around that hematoma. And last but not least, that is going to cause an inflammatory cascade and further the tissue injury. When it comes to the risk factors of strokes, they are many, but most of them are very common. So there are the non-modifiable ones and the modifiable ones, of course, meaning those we can change or we can pretty much modify or adjust. But some of them we can't, such as when somebody is over the age of 55, somebody is from the male sex, someone who has a family history or a genetic history of strokes. That makes them more prone to have a stroke, of course. When it comes to the modifiable risk factors, we have the single most important factor, which is hypertension, diabetes, smoking or excessive alcohol consumption, dyslipidemia, obesity or having a sedentary lifestyle overall, and of course cardiac disorders such as atrial fibrillation or valvular diseases that usually make the person have a propensity towards forming thrombuses inside the heart, which can migrate and cause strokes inside the brain. There are other considerations such as the intake of oral contraceptive, which causes a hypercoagulable state inside the blood. Especially when it's combined with smoking. So it becomes a major risk factor for strokes, as well as having a recent myocardial infarction. And now we're going to move to the clinical presentation. I hope I'm not going too quickly. So when a patient presents with stroke, usually the onset is very sudden. There is a sudden neurological deficiency. It's usually focal. At the neurological exam, the motor exam, we're going to notice a hemiplegia or hemiparesis, most commonly a face droop, facial paralysis, and limb weakness. At the sensory level, we usually have either numbness, tingling, and loss of sensation in the paralyzed section. In terms of speech and language, there is something called aphasia. I think we've all memorized like Broca's aphasia and Wernicke's aphasia, which is a deficiency in speech. So the person, it's usually very flagrant. It's very obvious. And in terms of a visual impairment, there is a homonymous hemianopia sometimes, or vision loss or blurring. Also, during the neurological exam, we're going to notice some motor and balance dysfunction. There's going to be vertigo, ataxia, or gait disturbances. Usually the patient cannot stand up or stand still. There are some trouble in consciousness. So a person could be comatose or be confused or have stupor. And there are, of course, other special syndromes depending on the location of the stroke inside the brain. There is a mnemonic that describes the clinical presentation, which is be fast. My apologies for my screen, sorry. So it's B is for the balance, E is for eyes. The person will complain of blurred vision. F is for facial droop or facial paralysis. A is for arms, so usually the arm weakness. and S is for speech difficulty. T is for time, so it is an emergency, so we must intervene very quickly or call an ambulance immediately. After the clinical aspect, we're going to move on to the diagnostic evaluation of a stroke. Of course, initially there's going to be a clinical comprehensive neurological exam, and there's something called the NIH stroke scale, which you can think about as the Glasgow score for strokes. I'm going to talk about this one particularly a little bit later on. Then, of course, we're going to imperatively do some imaging exams, most commonly a non-contrast CT, which is gonna rule out the hemorrhagic stroke most commonly. The gold standard to diagnose an ischemic stroke is going to be the MRI. And after that, there are some other specialized exams like a CT angiography or MR angiography, which is going to assess the level, the vascular level, if it's an aneurysm that's ruptured or what is exactly that's causing this stroke. There are other investigations that we can initiate, but these are most usually to determine the etiology of the stroke. So often there's going to be an ECG to see whether the patient is in AFib or he's having an arrhythmia, and some common routine lab exams like glucose, CBC, coagulation, lipid profile, and so on. In terms of acute management, well, for an ischemic stroke, the management differs a little bit from the management of a hemorrhagic stroke. For the ischemic one, we're gonna initiate thrombolysis within the first 4 to 4.5 hours from the onset of symptoms. Then we're gonna, if necessary, we're gonna initiate the mechanical thrombectomy by neurosurgical intervention or interventional radiologists. Which is usually indicated for large vessel occlusions, and it can go up to 24 hours in selected patients. Monitoring blood pressure, glucose management, and all that is done, of course, in the ICU. For the hemorrhagic stroke, the management is going to be imperatively, of course, the management of blood pressure, usually reduction of blood pressure. We're going to try to reverse any anticoagulant therapy if the patient is taken one. And of course, there's going to be neurosurgical intervention. So if there's an aneurysm that ruptured, it must be clipped. Or if it's a large thrombus, it's going to be mechanically removed. And of course, there are some general measures, such as the prevention of complications, like aspiration pneumonia if the patient loses consciousness, DVTs or pressure ulcers. These are some representations of the acute management. So this is an aneurysm clipping. This is the reparation of a blood vessel. And this is the mechanical thrombectomy. These are proactive healthcare measures that we take that are aimed to prevent the recurrence of a stroke in a patient who previously had one, and therefore try to improve their outcomes. Initially, there is antiplatelet therapy through aspirin or clopidogrel. Then anticoagulation in patients with AFib or a hypercoagulable state. And of course, various doses of statins for atherosclerotic strokes. Most importantly, there's also going to be a focus on modification of lifestyle in patients who smoke or do not or have a sedentary lifestyle. So we have to focus on implementing their diets and their exercise routine. There's going to be, of course, an attempt to monitor and to balance the patient's diabetes and control their blood pressure. And in certain cases, there must be surgical interventions such as carotid endarterectomy or stenting if indicated. In terms of complications, well, there are many complications related to strokes, unfortunately. Some of them are early, some of them come later on. When it comes to early complications, we have cerebral edema and raising intracranial pressure, usually caused by the hemorrhagic strokes. An ischemic stroke can sometimes transform into a hemorrhagic one and complicate it even further. Also, it is very common for patients to have seizures or aspiration to pneumonia. In terms of late complications, we can have spasticity and contractures, handicap and impairing situations for the patients. Of course, there's depression or cognitive impairment, epilepsy, of course, and there is the recurrence of stroke. Statistically, every 1 in 4 patients that already had a stroke is going to have another one within 3 or 5 years, if I remember correctly. Lastly, we're going to speak about the prognosis of strokes. Well, the prognosis of a stroke depends on many things. First of all, the stroke type, hemorrhagic or ischemic, and its size and its location. The score at presentation of the National Institute of Health score scale, which is a standardized tool used to objectively quantify stroke severity and neurological impairment. It is a tool for clinicians to determine eligibility for acute treatment like thrombolysis or just monitoring, and it can predict long-term recovery and outcomes based on that score, which ranges from 0 to 42. Another factor that plays into the prognosis is the age of the patient and their comorbidities, the time to treatment, so how quickly we were able to manage their stroke. Of course, the earlier treatment initiation, the better outcomes. And there's also their rehabilitation and their follow-up after that stroke. That's also going to be a determining factor in their prognosis. Well, in conclusion, we have to say that stroke is a very time-sensitive neurovascular emergency. We can also argue that is a multidisciplinary condition. The early recognition and rapid intervention can really save brain tissue and improve outcomes. The primary and secondary prevention through risk factor control is very critical and imperative. And so there must be an emphasis on patient education if they have high blood pressure or diabetes. And multidisciplinary care, including acute management, rehabilitation, and long-term follow-up, is also essential. So that is it. Thank you very much for your time and attention. And I hope it was clear enough.
Thank you so much, Dr. Nasila. This is great, excellent, brief, concise presentation. Yes. Any questions or any comments, any experience or personal input from you guys? I know it's an important topic and it's a big topic, but this is basic that we need to know. All right, if no questions, we can move on to the next topic. So let's see if Dr. Marianne is here, or Dr. Avinash. Please, uh, any one of you, welcome. And would like to congratulate both of you. We are very happy for you guys. And both of you matched to your residency program. So I'll start with Marianne first and followed by Avinash. If you are available, please go ahead. Thank you.
Hello, everyone, and thank you, Dr. Nader, for this opportunity, and thank you for your support during this journey. I'd like to share my experience during the last match season in case it can help somebody else in this process. So the first thing I would like to mention is you guys should believe in yourself because you can find some people who's gonna doubt you. Especially if you have some red flags on your resume, like gaps, attempts, or low scores, for example. So I want to tell you that from the colleagues I worked with, that most of the applicants, they have red flags. It's not only about you. Uh, like it's all about how you address these red flags in your application. So, for example, if you're an old grad, it's very important to have recent US clinical experience, particularly if you live in the US, because most of the old grads actually they are living in the US. That's why they delayed in their process. So, for example, you should do US clinical experience, get strong LORs. Dr. Nader help us with this. You can also do or participate in research projects. The fellowship will provide you with great opportunities, and also there are some other institutions that can help you with that, like IMG Helping Hands, SARTI group, they can help you with that. And try to get mix of LORs, like some LORs from university, big hospitals, and other LORs from programs that you have really high chance to match with. And there, like you can find online some lists for the programs that they provide free observerships for IMGs online. The other thing is if you have an attempt, if you have low score, it's very important to pass the 3 steps before your match. So for example, I had an attempt in old attempt in step 1. So I worked so hard to get a good, reasonable score in step 2 and pass step 3 before the match season. For all the grad IMGs, it's very important to pass step 3 before you submit your application, or at least you have a deadline for taking step 3 so you can mention this during your interview. The other thing is start very early to work on your ERAS application and your personal statement. This process is lengthy, and as IMGs, we're not familiar with these things. So it takes us many trials to reach to the right format, learn how to express ourselves, and you should reach out to your colleagues, your mentors to help you review your application multiple times and try to avoid burning out during the season because, as I mentioned, it's lengthy, it's stressful. So try to surround yourself with positive people. Don't work on it by yourself. If you have other colleagues or other co-applicants applying during the same match, reach out to each other. And if you have a mentor, work with them and try to be positive all the time because I know it's very stressful. And if you're applying for particularly internal medicine, research is very important. You should have it like uh, like average what I heard from co-applicants, like 3 publications, valuable publications. And also working in this fellowship, you're going to have a lot of opportunities to present, to do poster presentation. And even the presentation, we do it online during the weekly meeting. It's helpful. You can attach the link of this application on your, of this meetings on your ERAS application. If you see interesting case during your rotation, work hard to, with your doctors, initiate the suggestion to like write this case report and try to publish it. You still have time. The other thing is, if you are also applying to family medicine or doing both internal medicine and family medicine, backing up your geriatric fellowship, this fellowship with clinical experience, talking about it during the interview is very helpful. So, for example, we talk about a lot about nursing home visits and how to address all the population with multiple comorbidities and complexities. So if you mentioned that you've done a rotation and you shadowed, like, for example, family medicine doctor, you cared for all people, and you also did like nursing home visits in real life, like you did a rotation in nursing home and you cared for all patients. This is gonna support the narrative of this fellowship, and that you are able to apply what you learn virtually in this fellowship in real life. The other thing is trying to learn how to sell yourself. And because this is really, we're not used to it. We're not used to talk about ourselves in confidence. And sometimes we're afraid to do this. But this is very important to do during the match season. Try to practice mock interviews with different people, as many as you can. Record yourself. Try not to sound robotic. It's difficult, but you can learn it. Uh, Try to practice all interview questions by yourself. Try to find the right answer, um, like that is gonna fit you, fit your story, and explain. Like you should have explanation for all the gaps or red flags that you have on your resume. Uh, this explanation, as long as you're picked for interview, they want to know the explanation. So it doesn't matter for them the gap anymore, as long as the explanation matters more, because if you give them a reasonable explanation, they will accept it. Because once you're considered for interview, they like you, but they want to like you as a person. They liked you on the paper, but they want to like you as a person during the interview. The other thing that take long time to review the programs that you're applying for. So there are 3 resources that you can use to review each program, because there are, like, for example, 650 for internal medicine and maybe 500 for family medicine. So you cannot apply for all of these programs, but you gotta work to find the program that's gonna fit you, or you're gonna fit for the criteria of this program. So we usually use Residency Explorer websites, FREDA websites, and you also go to the program website itself. You look for if you need visa, look for visa sponsorship. Do they take IMGs or not? Do they have a year of graduation cutoff or not? Step score expectations. If they have attempts, they accept applicants with attempts or not. And like do your investigation, and even open the images for like, for example, if you found on one website that they don't take all IMGs, go and look for it sounds funny, but that's what we did. Go look for the like applicant photos online and see if they are really fresh grad or they are old grad. Go to Residency Explorer and see if they take applicants with attempts from the circle they have. You will know, like, if they are really restricted about not taking applicants with attempts, or there are a few exceptions. The other thing is about if you get an interview and they offered you a second visit. Some applicants, they swear by the second visits, and other they think it doesn't matter. Um, I don't think you can, especially if you get many different interviews, you cannot do all the second visits, because it's gonna cause like financial strain for you. So pick the most important or programs that you're interested in, and if they offer you second visit, go. But don't burden yourself with going to all the programs that you receive second visit invitation from them. The other thing is programs, they care about you as a person, not only as a resident. So like medical resident. So if you have done any community service, volunteering, you mentored other students before or other co-residents, mentioned this, and from my experience, I had one or two on my ERAS application, and they talked like almost in 60% of the interviews about these volunteering experience. So it's very important to show them that you are a human and you have other activities outside of medicine. But please try not to lie, because they know if you're like putting this as like something that may make you look better. So try not to lie and be truthful about everything you're going to put in your application. And from other friends that I learned that if you do any post-graduation training in your home country, own it very proudly, because they value it. I thought in the before that they don't value training in other countries, but it's very important. And try not to be negative, even if your residency was not the great thing that you had. Try to mention the positive stuff, and like turn the negative into positive. Like for example, if you like in our home countries, at least in my home country, residents they work 36 hours shift regularly. So instead of mentioning this as negative thing, you can say that I can stay focused for long hours under pressure. I don't crumble. I know how to provide patient care even in high stress environments. So this is gonna help you. Like they know that even under stress, you're not gonna crumble. You're gonna survive, because you don't know how stressful residency is sometimes. So they value these things. So they know that you're resilient and you're not going to complain. The other thing that it's like, I think it's very important that you should protect your mental health, because this journey is long. There are sometimes you can get burned out. So try to take breaks if you can. Surround yourself with other people. Don't work by yourself. Try to work with other persons so you learn from them and get support. And at the same time, you invest with them in their process. You're gonna sometimes have like moments that you're gonna enjoy with them during this stressful time, and you will be able to succeed. And I wish you all the best.
Thank you so much, Dr. Maria, for excellent tips, and hopefully this will help many of you guys. Uh, Thank you once again, and congratulations.
Thank
I
you.
wish you all the best. Keep us posted, right? So now, Avinash, if you have a minute, maybe you can share your experience or your tips, your advice.
Yes, sure. Thank you so much, Dr. Avinash, for having Dr. Nadir for having me. Pretty much is covered by Dr. Marianne, and she explained very well everything about the journey. Being an old international medical graduate, I know it is not an easy journey, but at the same time, it is not impossible. Everything can be possible with the consistency and persistence. So I would like to share about a little bit about my journey since I'm an old medical graduate, and there were a lot of uncertainty, and I always do not have any clear roadmap, and so we had to learn from these trials, errors, and guidance from the mentors, I know like the STEP exams are very important, but they are also these are only just a part of your application. Try to make your application more strong. Try to get involved in the US clinical experience. For me, gaining US clinical experience was extremely important because it helped me to understand the US healthcare systems, improve my communication skills, and most importantly, build connections. And at the same time, the US clinical experience should be like mostly from the university and the hospital based settings. So, and yes, if you have any home country residency or any experience, that is also, an extra point in your application. I also worked as a medical scribe in the US, and I did a volunteership virtually. So during my interview, they asked me all these things. So I must say, if you are having any opportunity, just grab it. Another key factor, I must say, is the consistency, whether it was any scribe or any volunteership or being involved in the research like telegenetic research fellowship or teaching. So everything is like important. Even if something like it doesn't seems very significant at that moment, but believe me, it contribute to your story. And another things I would, again, I'm totally agree with Dr. Marian that we do not have to just apply randomly. We have to do some work on our selecting of the programs. There are too many programs. Open to FREDA, Residency Explorer. These are the resources where you can go and put your credentials over there and look at the program, everything like the percentage of IMGs, USMDs. So on that basis, you should have to make a list and apply on these programs. Another things, again, the interviews, which is another important area where people mostly feel stressed. My one advice and the biggest advice is to be genuine. Always be like, what have you done in your life? Just be genuine in that term. They just want to see your communication skills, professionalism. They are not evaluating your knowledge, but they're just trying to see how the person you are. I must say, like, if I could go back and change something, I would start networking and seek mentorship sooner. So having the right guidance can save you a lot of time. So yeah, and make sure your CV, whatever you are putting information in your CV, it should be like correct, securing a strong letter of recommendation. Um, at the end, I would say like this journey can feel long, sometime overwhelming, but it is definitely achievable with persistence and consistency and strategy. Um, yeah, that's it. Please feel free to reach out to me if anyone have a question or if anyone need help in CV review or any personal statement or just general guidance. You're most welcome. Thank you so much.
Thank you so much, Dr. Avinash, and good to have you again. And I wish you all the best. Thank you for sharing all these great tips. Any questions for Dr. Marianne or Dr. Avinash? Or if there is another fellow who matched, please share your tips. I know from this program, I think we have about 36 or 37 fellows who matched this year.
Hello, Dr. Nadir.
Hello, Dr. Lina. Hi.
Yes, hi. How are you
Welcome.
doing?
So, very
Yeah,
good. Thank you so much. How are you?
yeah, I'm doing great. Thank you so much. And I want to also share that I matched this cycle. And I want to start by thanking you and thanking this great fellowship because it was very great addition to my CV and it was really helpful for me. And also congratulations, Dr. Avinash and Dr. Miriam. And I think they cover most of what I want to say. But maybe I will add that for me, the thing that I really want to highlight is that focus more on the application process by writing the eras carefully and signaling. Yeah, I believe signaling is one of the really hectic process in writing eras or in choosing the program. I just want to highlight that the importance of signaling carefully and strategically. Try to get as much as information you can from the program inside the program. Maybe connect with resident either or fellow inside the program. They are very helpful and tend to give a lot of great tips about the program. And example for that, I want to share a story about a program which I received interview from. After that, I connect with my with a colleague. Oh no, he's not colleague, but is a friend who was working as a resident there. And he, when I was asking about the program and how is what is things that setting it apart or what is its strengths, he shared with me that the program director is really someone who is humanistic and he tend to really focus on the I can say the charity clinic, the outreach program, and he was a big advocating for the Burmese population. So he told me that story, and I use it as maybe as a question to connect with him during the interview. And also, I'm someone who is very interested at outreach program, and it was very obvious at my application at that time. So it was, yeah, it was maybe a um, I asked him about that, and he tended to give me a lengthy answer. And it was, yeah, I think it was a great moment for me. So I just want to highlight that please do your research a lot about the program and try to connect with people there. Try to have a lot of networks. And yeah, I think most other points are covered with my colleague. And yeah, please, if you need anything, try to reach out to me.
Thank you so much, Dr. Lina. And this also, thanks for the tips. Thanks for sharing your experience and advices. So, congratulations to you all. Any questions for any of these three fellows or anyone else? If not, I'd like to congratulate you again, and if you don't mind, share your email on the chat. So any one of the fellows in this meeting, if you want to reach out with any further questions or specific area that you want them to guide you or help you with, please reach out. Many congratulations to all of you, and I wish you all the best. And I request that you keep us in your journey, keep us posted. If no more questions, we can move on to the next topic.
Excuse me, Dr. Nader, I'd like to
Yes,
add
Dr.
something.
Marianne, please. Yes.
So having a LinkedIn profile during the, like from now until you're like until the applicants are done with the match season, it's very important because it helps with the connection. Even preparing for interviews, like you can reach out to the residents at the program that you receive an interview invitation from. You can ask them and they can help you even find the right questions to ask during the interview. This is something I didn't do, and I found it helpful, and it helped other colleagues during their match season. So if you don't have a profile, try to, and I think we had a lecture before during this fellowship about how to create a professional LinkedIn profile. So if you can write this in the search bar and find it, it's going to help you to create one, and this is going to make your communication easier with other residents during the interview season.
Excellent. Thank you so much for raising this point. And as you said, if any of you interested in specific programs, you can use their website or you can use their LinkedIn. And as Dr. Maria mentioned, you can specifically find certain residents or chair or, chief resident. They can answer your questions if you connect with them. And the other way is to also look at their website. Some of the programs, they have a list of residents, the first year, second year, third year, and so on. And you can get their emails, or if you call the hospital, they can give their pager number if they have pages or contact info, and then you can contact them to help with preparation and so on. Thank you so much, Dr. Marianne, for this great tip.
Thank you.
You're welcome. Any other comments from you, Lina, Avinash, or Marianne?
Yeah, I must say, like the LinkedIn profile is also very important. Yeah, try to create your profile from day one and put all the, information and all the experience in there. Yeah, and try to make a connection, try to make a network. Thank you.
Thank you, Avinash. I have one question for you guys. Did they ask you during the interview about the fellowship? And if they did, what was your answer? If you can just share. Thank
Yes, my program director specifically asked me about this research fellowship, how this work, and specifically like the sponsorship and how the presentations and how the research things done and what is the curriculum. So everything she was interested in that, and she was very impressed about the program. And yeah, tried to make sure like having a couple of research um, from this fellowship. So publications, I would say publications, yeah.
Sounds good. Thank you so much.
Uh, I was asked about the geriatric fellowship, particularly with family medicine interviews. They cared about this fellowship and like what we're doing, what we're learning, and I also try to emphasize that we're learning a lot of clinical stuff during this fellowship. It's not only about research, and that we learn about telemedicine, technology, and innovation, especially in the rapidly evolving medical field these days. And they like this. A couple of them asked me about the mobile app we developed during the fellowship. And I also talked about how we grow personally as you provide us for with some like leadership rules in the beginning. Like when I started, you can like, or as any fellow when they start, you can start leading a subgroup. You can do a research project or uh, any kind of publication in or do like technology stuff, and then after this you can start leading a big group. So you grow personally in trying how to develop leadership skills. And this is really important during the residency, because we're gonna have like medical students, we're going to have other like senior residents and interns, and we're gonna learn how to be interns to senior residents and learn from them. And at the same time, we're gonna learn how to be senior and teach other residents. And they liked this, and they liked what we learned and valued the stuff I learned during the fellowship.
Thank you so much for sharing this aspect as well.
And yes, I want to share also that I have been asked about the fellowship, especially the part of technology, because I participated in an app that called MedMissBuster. So they asked me about my role in that, which I described that I am someone who's caring about the content, about caring looking for the misses and collect information, especially from the social media. And also they asked me about the research part and the virtual session and the topic that we are discussed. They're very impressed about that, and I agree that it was a great addition to my CV.
I'm glad to hear that. Thank you so
Yeah,
much.
thank you so much, Doctor. Thank you.
Yeah, thank you so much. Great to hear. And for the fellows in this program, I think you have many opportunities to grow and either learn new skills, you improve your skills and your knowledge and your personal aspects as well. So thank you for sharing all these comments. All right. Once again, thank you, everyone. Thank you for your great input and sharing your experience. And I wish you all the best. We'll see you in the future. Hopefully, you can keep us posted, and wish you all the best. If no more questions to them, Avinash, Lina, and Mariam, then we can move on to the next topic.
Thank you so much. Have a good day.
Thank you so much. Have a wonderful day. Let us keep in touch.
For sure, yes.
Yes, we will, for sure.
Thank you once more, and I wish you all the best, guys. One more thing before you leave, I want you to, if possible, share, like fellows in the past, some of your personal statement or your application. Just if you can declassify or remove your identification info if you want to share it, that would be great. Hopefully, this will help some of the fellows in the future.
Sure, I will send you. Yeah.
Okay. Thank you so much. Have a great day, all of you. Carlina, are you ready? Are you going to present the CRISPR, Dr. Lina, or should we go to the other topic, Dr. Almar?
Oh, I'm so sorry, Dr. Nadir. I will move my presentation for next week.
Yes,
Yeah.
that's fine. So,
Yeah.
yeah, I thought that I just wanted to make sure if you are available. So next week you will present. Thank you so much,
Yeah.
and we'll see you next week.
Yes.
But you can
Thank you so
say
much, Doctor.
you're welcome. Dr. Almar, when you are ready.
Hello, Dr. Nader, and to everyone
Hello.
attending. I hope you're doing well. I have been gone for a while, but I'm so glad that I'm back now. First of all, I would just like to say congratulations to everyone who matched. Thank you so much for your insightful, you shared really important information, especially for us who hope to match as well. So thank you so much for that. And thank you, Dr. Nader, for giving us the opportunity to connect. And yeah, so I will now be sharing my presentation. I will just 1 minute. Is my presentation visible or?
Yes.
Okay, perfect. I'll just try to make it full screen. So while I do that, just a quick review is that today I will be talking about literature review, understanding the literature reviews, the types of literature reviews, and just a little help to see what are the types, and hopefully that will help us to choose the right type for the right research that we want to do. So first of all, we need to know why it matters. So before we look at how, we need to understand why. A good review ensures your research is not really happening like in a vacuum wherein there's no foundation, there's nothing to build it on. So a good review ensures that your research is built on actual existing work. It acts kind of like a roadmap. You identify the knowledge gaps, so you know exactly where the new research is actually needed the most. And also, obviously, we don't want to be doing any research that will be duplicated. So it saves you the time by not repeating finished work. So it kind of saves us from reinventing the wheel. And it also leads to evidence-based decisions grounded in hard facts. So basically, it helps us have a solid foundation for our research. So there isn't just one way to do literature review. Depending on your goals, actually, there are 8 major types you might consider. They range from the narrative review to the systematic review, and then you have other types like scoping, meta-analysis, critical, integrative review, umbrella review, and rapid review. Let's break down the most common ones that you will be encountering. So the first two is narrative versus systematic reviews. I believe this is like the most frequent choice. This is the most frequent thing that you choose between, which is between these two types of reviews. So regarding the narrative review, think of it as like a big picture summary. It's great for the textbook background info, but it carries a higher risk of bias or errors because it's less strict than systematic review. So for systematic review, It's actually the golden standard for clinical research. It follows a rigid guidelines like Prisma to ensure that if someone else did the same review, they would get the same results. So, for example, here, a narrative review might look at trends in hybrid work, while systematic reviews would look at the wearable devices in chronic disease. So it's more focused. It's definitely the one to go for regarding clinical research. And yeah, that is the difference between these two. And then we have scoping reviews and meta-analysis. So for scoping review and meta-analysis, so for example, if you're working in a brand new field, you'll likely want to opt for the scoping reviews because it's really all about mapping out the territory and finding the gaps when we aren't yet really sure about the quality of existing evidence that's already there. So this is the nice thing about scoping reviews. However, if you do need to prove something with numbers, you move to meta-analysis. It uses statistics to pull data from like multiple studies into one single effect size, giving you a high level of mathematical certainty, which is obviously something that we value very much when we're doing clinical research. And then we have critical versus integrative review. So sometimes you need to be more than just like a reporter. A critical review goes a step further by evaluating and critiquing the actual work. You kind of challenge old assumptions, basically. And but the integrative review, it's a powerhouse in social sciences and nursing. It solves complex problems by combining both qualitative and quantitative data into one cohesive picture. So then you will have a better understanding of whatever it is that you are basically doing the research about. And then you have the umbrella and the rapid reviews. So for the umbrella and the rapid reviews, I apologize. There has been a mistake in this one, but I will be explaining the difference between the two. So you have the high level versus high speed option. So the umbrella review is essentially a review of reviews, basically, from the term itself. It gives you the highest level of, let's say, evidence synthesis for policymakers. But if you're in a crisis, from the name itself, you could do a rapid review wherein you're going to trade thoroughness for speed. So you're going to be faster, but not as thorough. This was actually essential during the pandemic when we needed answers like in weeks, not years, especially like with COVID and everything. So you could say that that was something that maybe perhaps they opted for. So what's the point of knowing the different types of literature reviews is to know how to choose. Start by defining your question. Is it broad or is it focused? And then you're also going to check your data volume and your timeline. Do you have months for a systematic review or do you have just weeks for a rapid one? Like, for example, as I said, during the pandemic and COVID, we actually needed answers very quickly. As you can see here, the table is supposed to be bigger than this. My deepest apologies. I don't know what's happening, but I will be continuing. So there was supposed to be a table that between different types of reviews, it's kind of a trade-off, as I said, between rigor and speed. So if you need statistical data, you're going to go for meta-analysis. If you just need background information, as I said, like a broad picture, you can opt for the narrative review. It's really your best bet here. Hopefully, I'll be fixing this and sending it to you so that you could make the most out of it. So I guess my final takeaway is that we need to remember to always match the tool to the task. As I said, you need to ask yourself, what is the volume of my data? What exactly am I looking for? If I need a statistical data or if I need just a background info. So it's important to know the different types of literature review in order for us to be able to choose it and come out with a really good and fruitful research. So really here, the takeaway is to, for example, we use systematic reviews for the highest quality evidence. Scoping reviews, we can use it for mapping new fields. And meta-analysis is when we need statistical proof, for example. So choosing the right review type definitely ensures the success of your research. And I hope that this is what we did in this kind of concise presentation that I gave today. If anyone has any questions, please do let me know. If you need any clarifications regarding a particular type of review, more examples, I would be more than happy to share that. And thank you so much. Dr. Nader, are you still there? May I ask if maybe I'm the only one who cannot hear, or is it a problem for everyone?
No, it's the problem for everyone. And thank you for your informative presentation.
Absolutely. You're welcome. I hope that it was beneficial.
Yeah, it was. And we would love if you can share the slides with us.
Absolutely. Do you mean to send you the presentation itself, right?
Thank you.
Yeah, absolutely. More than welcome.
Thank you so much, Dr. Amar, for a great presentation. Sorry, I had to step for a minute. So one thing you can do, Dr. Amar, if you want to upload the file to the app, when you go to today's meeting, you can click at the bottom, edit, and then you can upload the file. Thank you.
Absolutely. Absolutely. I will do that. Thank you so much, Dr. Nader.
Appreciate. So if there is no more questions, to Dr. Almar, we can move on to the next. I think we'll have some updates, right? Dr. Muhammad Abdurrahman, how are you?
I'm good, Alhamdulillah. How are you, Dr. Nadir? Long
Very
time.
good. Alhamdulillah. I'd like to ask question or comment or share.
No, I just came here. It's been a long time. I just came here to say thank you so much that I've matched to internal medicine this season. I just wanted to give it back to the group, the work they have done together. Thank you so much, guys, and thank you so much, Dr. Nadir. Your your geriatric research fellow, it helped a lot. And all my interviews, they've been asking about it, like how is it? They are very curious about it. And thank you so much again. You are muted. You are muted, Nadir.
Thank you so much for sharing this, and congratulations. Thank you for showing up and sharing your experience. Can you share any other tips or advice to the group, to the fellows in these programs, from your experience, from your interviews, or any preparation? What did you do?
Yeah. First of all, I'm a 2024 graduate, and I've been here in the group since 2023, and I've been doing a lot of things, activities in terms of projects, in terms of presentations. And also, one thing that I would like to give back to the group in terms of the applications is like make sure you start early on preparation of the applications. Like right now, you have to start like writing your own era CV experience, and make sure you have a good personal statement. We all came from a place we all know back home, so make sure you tie to your experience to that one, and also why you want to come here, and then why you want to do maybe family medicine, internal medicine, or neurology. Because personal, I think I had a 14 interviews, and all the 14 interviews they were asking about my personal statement. They were asking me about, "Hey, tell us about your back home, how you survive, how things was like that, how blah blah blah." And then the second biggest thing they were asking about was like, "Can you tell us about your geriatric research fellow? We are so curious about it." And I talk about it. I was like, "Taking data, I was doing this, I was doing this." Make sure you list all the experience, whatever you have done, and that will be a very, and also make sure you prepare the interview. I mean, as we are international medical graduate, we have never been in interview places when we're going to maybe medical school or college, these things. The American graduate, they are used to it. So make sure you prepare the interview season like early. The moment that you submit your applications, make sure you start preparing the interviews, because once you get interview, scores doesn't matter, CV doesn't matter, personal statement doesn't matter. What matters is the interviews. If you do well in the interviews, you're gonna go match. And if you're not, then I don't know. So make sure you make our own group when you start the interview season, where you start like practicing every night. I used to do practice every single night, like 1 hour or 30 minutes with my friends, and then go for it. Yeah, that's all. Thank you so much.
Thank you once again. Appreciate any questions for Dr. Muhammad?
No, no, I don't have any questions. Thank you so much.
And no, from the fellows to you.
Oh, okay.
So once again, I'd like to thank you and congratulations. If you don't mind, maybe they will have some questions later. Do you mind if you share your email in the WhatsApp? In
Yes.
the chat?
Oh, okay.
In the chat now.
I'll share my email and also my WhatsApp. Uh, feel free to text me, as I was always like texting people, asking like ideas, advice, you know. So please feel free to text me and ask me anything. Inshallah, I will try to do my best. Khair, inshallah.
Inshallah. Jazakallah khair. Thank you, and appreciate your help and tips. So I'd like to share with you a new information that I think might be new to some, but the ABIM, the American Board of Internal Medicine in the US, now considered and approved one of the pathways. It's a special consideration that's for IMGs, basically. So there are 4 pathways, A, B, C, and D. Pathway A, international graduates who are full-time and US or Canadian faculty. So in this group, if you have accredited medical school, you graduate from these schools, then you will be eligible to apply. So eligibility include at least you successfully complete 3 or more years of training in internal medicine or subspecialty overseas abroad. If you have academic rank like assistant professor or higher, that would be also plus. Full-time faculty appointment for minimum 3 years also. It's a good thing. If you have a certification in internal medicine or subspecialty, also that might be also an addition. So if you have a valid unrestricted license in some places like Canada, you might apply for this pathway. The second pathway is program director accreditation or faculty member accreditation and graduate of AOA. But you can read more about these options or pathways. Pathway number 5, which is pathway E, it's the pilot or competency-based medical education. This is what is worth spending some time. So who's eligible for this? If you, again, successfully completed 3 years of medical training after medical school abroad, outside of US or Canada, and accepted into a subspecialty fellowship program like geriatric medicine, infectious disease, or nephrology fellowship programs here in the US, then you will be eligible to sit and take the board, the internal medicine board exam, and you will be certified. So the fellowship usually, if you had experience or some period spent after 2016, then it will be considered. So what I suggest for those who are in the US who did not match this year, if you have US citizen, if you have green card, if you pass step 1, step 2, and you have the time to stay to take step 3, or if you took step 3, then consider applying to these fellowship programs. You can spend 1 year in one of these fellowship programs. Some of the program may extend that to 2 years. The other way, some people will finish the first year in the fellowship and then apply next year into residency, either family medicine, internal medicine, or other. And then you will be more competitive. You already have clinical experience approved and training here in the US. You will have plenty of opportunities to get recommendation letters from the program director, which is a big deal, and other faculty members. You will have clinical exposure to the clinical system, the EMR, and so on. So if you have difficulty to get into the residency directly, then this is another pathway. You do the fellowship, and then you come back to the residency. And many of the fellows in this program, they did that successfully. The good news is that you will be eligible to take the examination and be licensed as a American board internal medicine physician in the US, and then you can work either independently, you can start your own business, you can join other programs, other groups, other practices. So it's kind of a good thing for international medical graduates who come to the US and doesn't go the direct way of entering their training through residency. So this is another pathway for you guys. Any questions or any comments, any addition to this point, please feel free.
Hello, Dr. Nadir.
Hello, Dr. Nadia. How are you?
Yes, thank you for sharing this for good, nice information with us. Just my question regarding this program: does this is happen in the all state or just specific in some states? It cover all 50 United States.
Yes, this is for all the states. So this is the American Board of Internal Medicine. So traditionally, or the common way, what I did, for example, is I go to the residency, I apply, I get accepted, I finish the 3 years in internal medicine. After that, I will be eligible to sit for the exam. When I pass that exam, I will be board certified in internal medicine. If I do an additional subspecialization, let's say I do cardiology or I do, in my case, geriatric, I will be eligible to take another test. To pass that test, I will be subspecialized in that area and I will be double board certificate. Like I have two specialties, internal medicine by itself and then subspecialty. And you can do as many. Some people will do two fellowship. Let's say after geriatric medicine, you will go to hospice and palliative care. So you will have internal medicine, geriatric medicine, and another subspecialty. You will sit for the exam and you can take that. So for you guys, in the past, you can do a fellowship for 1 year, but the problem is you will not be able to practice after that year unless you go back to residency, for example, or unless you spend another year for that with that program or different fellowship program. But this pathway is for all internal medicine or any subspecialty directly from internal medicine. If you have some experience from outside, you come. If you do some experience like the fellowship, for example, clinical, then in any of the states, when you sit down for the exam, the board exam, it's for the US, the whole. Then you pass that, you will be certified as a internal medicine board certified physician. I hope I answered your question.
Yeah, just my question regarding I have to do fellowship for 1 year and then after that I go through this pathway. Like I have to apply for fellowship program like geriatric, infectious disease, and then after I completed the fellowship, I'm gonna go through this pathway.
So yes. So did you have any experience outside the US?
Yes,
Clinical experience?
yes, in outside or inside United States.
No, outside. So the
Yes,
first
I
criteria
have
is,
a family medicine residency in my home country. Already, I
yeah,
did
no,
some.
they don't consider family medicine. They want training in internal medicine,
Uh-huh.
at least 3 years.
Yes, I have experience also in internal medicine because in my home country we do
Yeah,
family medicine like internal medicine, work in the primary health care, and just we work as internal medicine. But
yeah.
I
So
have
if
experience
you
in.
did,
Mhm.
yeah, if you did the internal medicine
Yeah.
experience at least 3 years
Yes.
overseas,
Yes.
then you will be eligible. Once you do your fellowship, then you will be able to sit for the exam, the board exam.
Okay. So I have to apply for fellowship this year, and after that, I have to keep continuing this pathway, right?
Yes,
Okay. Sounds good. Thank you so much.
you're welcome. I'm gonna share this with you guys in the chat just in case you need.
All right.
Any other questions or any other comments? If not, let's move on to the updates. Any updates from you guys, like any new projects that you are working on or new ideas? Or any questions about the fellowship? So just interrupt me if you have any. I'd like to thank you all, and I have some new fellows in the program. Please, if you are here as a new fellow, let us know if you have any questions, anything unclear for you guys. Welcome to the program, first of all, and if there is anything that needs to be clarified for you guys,
Hello,
please.
Dr. Nadir.
Hello, Dr. Malian. How are you?
I'm good, thank you. I'm one of the new fellows, and this is my first time here.
Welcome to the program.
Thank you so much. I just want to start off by saying thank you for providing such a platform to help us international medical graduates with our own journeys. Everything right now just feels quite overwhelming for me to see all of these great achievements and everything, and I'm just I think I will need a bit of time to grasp everything.
Yes.
But I'm going to go through it slowly and hopefully get the hang of it and be up to date with you guys as well.
Sounds good. So if you follow the instructions in the email, the welcome part, and then slowly, as you said, you can continue with the team leader. Each team, they will have their own team leader, mostly the
Yes.
senior. And then if you have time to look at the app itself, it has many resources. So whenever you have a minute, look at what happened, let's say last week or the week before, or if you have a specific question or research idea, you can look at the projects that were done and so on.
Okay, thank you so much.
You're welcome. Thank you. Welcome. Anyone else?
Assalamu alaikum, Dr. Nader.
Alaikum salam, Dr. Nada. How are you?
I'm fine. Yourself? I'd like first to thank you for holding this informative session and thank all of our colleagues who matched and shared their valuable, I would say, personalized feedback. We really appreciate that. My question is that, I'm definitely interested in research and I hope to actively participate in this group. Just, I'm really interested in pediatrics and I'm aiming to apply for pediatrics next cycle. So my question is that, do you have, I know this group is mainly focused on adult research, but my question is that, do you have any children or adolescents subset, data subsets, which I can focus on to tailor my application next cycle to pediatrics specifically? And thank you.
Thank you so much, and welcome to the program, Dr. Mada. Yeah, the program initially stated or started focusing on geriatric, but as we grow, we had more fellows in the program with diverse interests, some of them in neurology, psych, and pediatric, as you mentioned. So, for example, Dr. Amal Alamin, I'm going to share her email with you guys in the chat. She joined this program and she was one of those who are interested in pediatric. So the concept is the same. So here we want you to learn the basic of the research, and you can apply it to any specialty that you are interested in. We want you to know how to start a research project from start from zero knowledge all the way to finishing that. If you have data, then you can work on with this data. If not, we can work on systematic review, or we can even develop a mobile application, for example, to address certain population, in your case, the pediatric population. So we are not restricted. It depends on your time, your interest, and your effort. So what did Dr. Amal do during her period with us? She worked in different research projects regarding pediatric patients, but also she is one of the first fellows when we talked about developing an app, and she learned how to do the back side of developing an app. Not only like we want you to use AI nowadays, it will do everything for you. Just we want you to use to have an idea about your target group or patients. So she learned the back side, and she has a team, and she was able to develop more than one application. And we were successful in uploading these apps to the Google Play Store. And she matched to residency in pediatric. So if you would like to have more information about her, or contact her and ask her, that would be something that wonderful. Hopefully she will guide you.
Thank you very much for sharing this information, and definitely will do. Thank you, Dr. Nader.
You're welcome. No pleasure.
Hello, Dr. Nader. I'm Akshata. How are you?
Hello, Dr. Akshata. How are you?
I'm good. So I was introduced to this group by Dr. Marian, and I'm very thankful for her because the class that I attended today was very informative, and I'm looking forward for much better classes from now on. Yeah.
Welcome to the program. And yes, so you will join a team, and you will have your team leader. And if you have questions, mostly the seniors, they will answer most of the common questions. And as we go along, we will learn more and more. Some of you guys, the new ones, maybe you have some experience, so we would like you to teach us as well. So it's kind of a two-way educational experience. So, and this can be also helpful. Let's say Dr. Kshata knows something about tool, let's say SPSS, in analysis of the data analysis. So what happened is she will pick one of the topics present to us, or she will help her team learn about the SPSS, or she will answer questions for the whole group about SPSS if they have specific questions. By that time, she will put in her resume that she was able to not only learn from the program, but also to teach in the program, if that makes sense. And programs like one of the fellows just mentioned, the residency program, I would like you to know not only how to become a resident and go through the residency for only training yourself, but also they want you to be a team member, also as a teacher for the ones coming, like the medical students, or when you come when you become second year, third year, you will teach first year, second year under you. So this will also highlight your abilities, if that makes sense. Thank you.
Thank you, Doctor.
Anybody else? If there is any questions or any new ideas for you guys for either new research projects, new questions, please feel free to contact us. If there is any interest in developing more mobile applications or tools that will help your patients, that also would be great if you can let us know so we can help you. If there's more questions, I'd like to thank you all for attending this meeting today. Thank you all the presenters from today's presentations. These were great. Thank you for your help. And I'd like to thank those who will come and watch the recording in the future. I wish you all the best, guys. And again, if you have questions, please contact me via email, call or text or WhatsApp. I'll be happy to help you guys. Thank you. Have a wonderful day or wonderful night wherever you are. See you next week. Assalamu alaikum. في أمان الله.
Thank you so much, Dr. Nader, and congratulations to all the football who matched. And thank you for this great presentation.
Thank you, Dr. Azza. Have a wonderful one.
Thank you so much,
Thank
Dr.
you.
Nader.
Thank you so much, Dr. Ammar, for your presentation and joining the meeting.
Thank you very much, Dr. Nader.
Thank you, Dr. Habab. How are you?
I'm good, Alhamdulillah. Hope you are doing well.
Alhamdulillah. Very good. Good to hear.
Thank you, Dr. Nader. Jazakallah khairan.
جزاكم الله خير. في أمان الله, Dr. Nada.
Thank you so much, Dr.
شكرا لك, Dr. Muhammad. في أمان الله. Thank you.
Just I want to ask one question regarding this general surgery match.
Yes.
I want to know if there is any colleagues I have a match or something. So just contact with them. Either.
Sorry, your voice kind of comes in and out. Can you repeat your question? I couldn't hear that.
Hello.
Yes, hello. Yes.
Yes. First of all, I want to thank you and all of these colleagues that match in this year. Just I want to ask about general surgery residency or match because I don't know anyone here match in general surgery because my goal. So I need someone to just contact with him and give me advice on something like this.
Oh, sure. Yeah. So we didn't have a lot of fellows who matched to surgery. I think we have a few. Let me just give me a second. So I will tell you one of the fellows who matched. Okay. I'm going to share with you the screen here in a second. So this is a website for the telegeriatric fellowship, and one of the, I think, conferences, no, webinars. Yeah, so if you go here, this was done during during the COVID. We talk about the effect of heart and COVID vaccine, but Dr. Akila is one of our fellows who matched to surgery. So if you would like to contact her, I'm gonna share the contact information with you guys. Just a second. So it's in the chat. This is her email. You can try to contact her and see if you have any questions. I think there is another resident or fellow who matched to surgery also. Let me see if I can find that. So Dr. Muhammad Ibrahim also. No, Dr. Ibrahim Mahdoub. Also, I shared his information. I think he matched to surgery program in Florida. So you can contact them as well.
Okay, thank you. Thank you, Dr. Nader.
You're welcome. Thank you.
Also, regarding research and project, also I don't found a specific in surgery or in general surgery. If you can share with you and begin some project or research.
Sure. So what I can help you with is with the use of AI nowadays. You can also build something out of scratch. What I mean is you can look at one of the journals and pick up any article, see if that article is talking about something that's of interest for you, and using AI like ChatGPT or Gemini or any one of the tools, you can upload that file, the article or the topic, and ask what area or what questions, research questions, can I get, like list 10 questions or 5 questions, research ideas or topics. This is what I did in the past with one of the fellows in this program. So we go over, let's say, a topic, and then you read about the topic, then ask AI to suggest some list of research topics in the area. And then by that time, you will have a list of questions that can be like starting point for research project. Then you can find out how you want to do what the method. Some of the topics can be systematic review, so you only need to review some of the studies done, and you can create a team and they can work with you. Another way is to review some data sets, so in a specific area, injuries, for example, fractures or something like that. And you can go by population, set of population. In geriatric, for example, you can say, I want to look at falls, fractures, and repair of hip, for example, in all others in nursing homes setting. So the more specified is your question, the better your research idea and method, so you can do a review. And the third option, after you find the question, the research question, and the method for you, you're gonna work on getting this done as a project. So your next step will be to convert this into an abstract. It's easier and faster. You can send it to a conference and then present it in a conference, either as a poster or sometimes as an oral presentation. if you want it to be published as an article, then you can work on getting this as a manuscript and identify which journal that can match this and they can accept it. And you can go ahead and submit it. I hope I answered your question.
Yeah, you answered. Yeah. Thank you. Thank you so much.
You're welcome. If no more questions, I'd like to thank you all again and have a wonderful day. Yeah, Amantillah. Assalamu alaikum.